Think about your pet's energy, when they zoom around the house. Or just that steady purr.
Yeah, all that get up and go.
It's all powered by these tiny engines inside their cells. But what if there's like a hidden flaw, a genetic issue messing with how they fuel up?
That's exactly what we're diving into today. Glycogen storage diseases, or GSDs.
Right, GSDs, they're inherited. Pretty rare, I gather.
Very rare, yes. And they affect how dogs and cats store and use glycogen.
Glycogen, that's their backup sugar supply, right?
Precisely. Think of it like reserve fuel tanks. GSDs mean there's a problem filling those tanks, storing them, or getting the fuel out when needed.
So this deep dive, we're going to unpack what happens when that system goes wrong, which organs get hit.
Exactly. We want to give you a clear picture of the different GSD types in pets, which breeds are prone, the signs to look for, the genetic causes.
But keep it understandable, not too much jargon.
That's the plan. Clear, digestible info.
Okay, so at the root of this are enzymes, these little biological helpers. How do they fit in?
You got it. Enzymes are crucial. They're like specialized workers that speed up reactions. For glycogen, some enzymes build it, others break it down for energy.
And in GSDs, one of those enzyme workers is faulty.
Or missing altogether. Doesn't do its job right.
Like a broken tool on the assembly line. So what's the fallout?
Well, the main thing is glycogen starts piling up. It accumulates in cells and organs because it can't be processed properly.
Piling up where?
Places like the liver, heart, muscles.
Hmm?
Even the kidneys and the brain can be affected. This buildup makes the organs enlarge and, well, not function as they should.
Okay, organ dysfunction. And you also hear about low blood sugar, hypoglycemia with these. How's that connected?
Ah, yes, good point. The liver's job is to keep blood sugar stable. It breaks down stored glycogen to release glucose when energy is needed.
But if the enzyme for that breakdown is faulty,
Then the liver can't release the glucose effectively. Bingo, hypoglycemia. Which is especially rough on the brain. It needs constant glucose.
sounds like there are quite a few different ways this can go wrong. How are these GSDs sorted out?
They're mainly classified by which enzyme is defective and which organs are primarily affected. It's interesting. Humans have, like, over a dozen types.
But fewer in pets.
Yeah, in dogs, we typically talk about 4 main types, IA, 2, 3, 3, and 7. And in cats, there's really one main one we see, type 4.
Got it. Let's dig into the dogs first, then. Type I von Gierke's disease. Hitting Maltese puppies specifically. That sounds rough.
It really is. Type IA is an autosomal recessive thing, a mutation in the gene for glucose-6-phosphatase.
Glucose-6-phosphatase. Okay, bit of a mouthful.
Yeah. But basically, it's the enzyme that acts like the final gatekeeper, letting glucose out of the liver storage into the blood. If it doesn't work, that liver glycogen is trapped.
And this shows up super early.
Yeah, juvenile Maltese pups, days, maybe weeks old. The signs are pretty stark. Failure to thrive, they just don't grow right. They seem depressed, mentally dull.
And the hypoglycemia, the low blood sugar.
Right, dangerously low. Plus, you might see a swollen belly from an enlarged liver, what we call hepatomegaly.
And the prognosis.
Yeah, not good. Sadly, no. Most don't make it past 60 days or so. Euthanasia is often considered the kindest route.
So for a vet, what are the clues? Besides the breed, I mean.
Well, that combo, Maltese puppy, really young, severe hypoglycemia. Blood tests usually show high lactic acid, high cholesterol, triglycerides, uric acid.
And family history, if known.
Definitely. If related dogs had similar issues, that's a big clue. Under the microscope, the liver is just packed with glycogen and fat. The kidneys can show changes too.
Any treatment hopes? You hear about gene therapy sometimes.
There is research, yes. Experimental gene therapy for type A has shown some promise, like extending lifespan in lab settings. But it's not a standard cure you can get yet. Still early days.
Okay, moving to type 2, Pompe's disease. Affects Swedish Laplands, related braids. This one's more about muscle.
That's the hallmark, yes. Type 2 comes from a mutation affecting acid I-glucosidase. This enzyme works inside lysosomes, the cell's sort of recycling centers, breaking down glycogen there.
So if it's faulty, glycogen builds up inside those lysosomes, in muscle cells.
Exactly. And signs usually appear by 6 months old.
What kind of signs point to muscle problems?
You often see vomiting, regurgitation.
Yeah.
That's frequently due to megaesophagus.
Where the esophagus gets enlarged and floppy.
Right. And then progressive muscle weakness, just overall. The heart muscle can also be involved, leading to cardiac issues. Unfortunately, it's usually fatal before they hit 2 years old.
Diagnosis clues for type 2, besides the breed, obviously.
Chest x-rays are pretty useful. They can show the enlarged heart, cardiomegaly, and the megaesophagus. An echocardiogram, an ultrasound of the heart, picks up cardiac changes too.
And tissue examination would confirm it.
Yes, pathologically, you'd see glycogen packed into skeletal muscle, smooth muscle, and cardiac muscle cells.
Okay, let's shift to type 3, Cory's disease. German shepherds, curly-coated retrievers, sounds a bit different. Liver issues, but maybe milder low blood sugar.
Correct. Type 3 involves the glycogen debranching enzyme. Think of glycogen like a tree with branches. This enzyme helps snip off those branches for glucose release.
So a debranching problem.
Yep. Affected dogs, often young females, might seem depressed, weak, maybe stunted growth. They get the enlarged liver and abdomen too. Hypoglycemia can happen, but it's typically milder than type IA.
And blood tests?
You'd likely see high liver enzymes and also high CK creatine kinase, which points towards muscle involvement as well.
So suspicion comes from breed, the juvenile onset, the liver signs, high enzymes.
Exactly. Imaging helps too. X-rays or ultrasound can confirm the enlarged liver, the hepatomegaly. Ultrasound might even show a specific sort of brighter look to the liver tissue, suggesting glycogen buildup.
And a biopsy would confirm.
A liver biopsy would show the glycogen accumulation. It can also build up in skeletal muscle in type 3.
Right. Last one for dogs, type 7, Tarui disease, wide range of breeds here, Springers, Cockers, Whippets, and this one affects adults.
Usually, yes. Adult dogs, no particular sex difference generally.
Yeah.
It's a defect in phosphofructokinase, PFK.
PFK, what's its job?
It's a key enzyme, kind of a control point, for breaking down glucose for energy, especially in muscle and red blood cells. There's actually a different mutation in the same enzyme found in Wachtelhunds.
Okay, so problems in muscle and red blood cells, what does that look like?
It's quite distinct. They often have this compensated hemolytic anemia.
Meaning their red blood cells are being destroyed too quickly, but the body is trying hard to keep up.
Precisely. And the classic sign is exercise intolerance. During or after exercise, they get weak, sometimes collapse. This exertion can trigger more red blood cell breakdown right inside the blood vessels.
Intravascular hemolysis?
Yes. And that releases hemoglobin, the red pigment, which then spills into the urine.
Making the urine dark. Hemoglobinuria.
You got it. There was also one unusual case reported of just progressive muscle weakness, a myopathy, without the typical blood issues. Usually the liver isn't affected in type 7.
So diagnosis relies heavily on blood work.
Absolutely. Seeing that anemia, seeing signs the body is making lots of new red cells, reticulocytosis, plus the pigmenturia, the dark urine, those are strong clues.
Can you test the enzyme directly?
Yes. There are specific lab tests that can measure PFK activity in red blood cells to confirm it, and muscle biopsies might show abnormal polysaccharide deposits.
Okay, that covers the main canine types. Let's switch to cats. Type 4, primarily in Norwegian forest cats. Sounds really severe, especially early on.
It is devastating, yeah. Type 4 in NFCs is caused by a mutation in the glycogen branching enzyme. Remember the debranching enzyme in type 3? This one does the opposite. It builds the branches as glycogen is stored.
So without proper branches, the glycogen structure is abnormal.
Right. It's not stored or broken down correctly. Many affected kittens are stillborn or fade very quickly after birth.
But some survive longer.
Some do, yes. They might seem okay for a bit, but then usually start showing signs around 5 to 7 months old.
And those signs are neurological.
Primarily, yes. Things like intermittent fever, muscle tremors all over, muscle wasting, weakness that gets progressively worse.
Leading to paralysis.
It can, yes.
Yep.
Progressing to tetraplegia, paralysis of all 4 limbs.
Yeah.
And tragically, sudden death can occur from heart problems, degeneration of the heart muscle, and fatal arrhythmias.
That's terrible. Is there anything that helps?
It's a bit strange, but providing supplemental glucose can sometimes allow them to survive longer, even into adulthood. But it doesn't fix the enzyme defect. The underlying disease is still there.
How would a vet suspect type 3 in a Norwegian forest cat?
Well, the breed is the biggest clue, especially if there's a known history of perinatal death kittens dying around birth in the family line. Then seeing that later onset of progressive neurological decline,
For ticks too?
an echocardiogram might show cardiac changes, yes. Often, though, definitive diagnosis comes after death, looking at tissues. You see the muscle atrophy and the abnormal glycogen buildup in muscle, but also significantly in the central nervous system, brain and spinal cord and peripheral nerves.
Looking across all these GSDs then, any general themes for diagnosis and management?
Definitely. First step is always suspicion based on the breed and any family history. That's huge.
And ruling other things out, because some symptoms sound quite general.
Exactly. You have to differentiate GSDs from more common causes of, say, juvenile hypoglycemia, like malnutrition, severe parasites, infections, portosystemic shunts, or muscle weakness from other causes.
What tools do vets use to narrow it down?
A whole range. Basic blood work and urinalysis give initial clues: the low sugar in Ia in third, the anemia in the seventh, maybe high liver enzymes.
And genetic testing, is that common?
Increasingly available for specific breeds and known mutations, yes. It can give a definitive diagnosis, which is incredibly helpful, especially for breeding decisions.
What about imaging?
X-rays and ultrasound can show organ enlargement, like the liver or heart, or other signs like megaesophagus.
And sometimes you need more specialized tests.
Right. Measuring the actual enzyme activity in a tissue sample, like liver or muscle, might be needed. Electromyography, EMG, to check muscle electrical activity,
Right.
or an electrocardiogram, ECG for the heart, can also be part of the workup depending on the suspected type.
And treatment sounds mostly supportive.
Unfortunately, yes, for most types. For type I and III, managing the hypoglycemia with frequent high-carb meals, maybe dextrose fluids in a crisis, is key. But it doesn't fix the core problem.
So long-term management is often challenging.
Very challenging and often, frankly, futile for the severe forms, causing significant hypoglycemia, liver disease, and failure to thrive. We mentioned the gene therapy potential for type Ia, but it's not routine yet.
Which really brings us back to prevention through breeding, doesn't it?
Absolutely critical. Client education is paramount here. Owners and breeders need to understand these are inherited conditions. Vets need to explain the available genetic tests, what carrier status means.
And the importance of removing affected animals and carriers from breeding programs.
It's the only way to effectively reduce how often these heartbreaking diseases occur. The prognosis for most GSDs causing those major early signs is just poor.
Okay, so wrapping up our deep dive today. The big takeaway is that glycogen storage diseases, while rare, are serious inherited problems. They disrupt how pets manage energy.
Right. Each type has a specific enzyme defect, often linked to certain breeds, and shows up with distinct signs affecting different body systems.
It really underscores how complex metabolism is and why awareness is key for vets and owners.
Definitely. Understanding breed risks, using genetic tests, it helps with earlier diagnosis, and crucially, making informed breeding choices.
And it does make you think, doesn't it? Learning about these rare pet conditions helps them, of course, but it also adds to our bigger picture of metabolic diseases across species, including us.
It really does.
What other hidden genetic conditions might be out there in the animal world? And what could they teach us about health, both theirs and ours? Something to ponder.